My name is Celia Walker. I'm a first-year family medicine resident at the University of Alberta, based in Yellowknife, the Northwest Territories.
My name is Owen, and I'm a fourth-year medical student at McGill University based in Montreal, Quebec.
We are honored to be presenting our poster, An Approach to Implementing Planetary Health Teaching in Medical Curricula. Climate change has been deemed by the WHO as the greatest global health threat of the 21st century. Not only is climate change impacting our healthcare system contributes to 4.4% of global greenhouse gas emissions. Healthcare professionals have a crucial responsibility to understand climate impacts on human health, how to manage and prevent climate related etiologies, and address the drivers of climate change. However, urgent changes in medical education must occur to equip healthcare professionals to advocate for health system transformations that prioritize the health of patients, communities, and the planet.
In a recent international survey, healthcare providers worldwide generally believe that climate change will harm their patients. However, almost half of participants cited lack of knowledge as a key barrier to engaging in climate action. Numerous international calls to action have recognized the urgent need for curricula on climate change and health. However, only 15% of medical schools worldwide provided teaching about climate change in a 2020 study. On our shores, in a national survey of Canadian medical schools that we conducted in 2021, 16 of 17 medical schools had some planetary health teaching, 7 schools tested on this subject, and only 3 provided longitudinal planetary health learning opportunities. There is a substantial impetus for the development of a comprehensive set of planetary health competencies in medical education to prepare future physicians to practice in a climate crisis.
These competencies were developed in a systematic, stepwise approach, starting with an extensive literature review, looking at the core topics in climate change, health, and sustainability. Next, the competencies were built and categorized, following which consultation with interdisciplinary experts in planetary health was sought and feedback incorporated. To determine if these were attainable goals from those who would be receiving the teaching, peer assessment and feedback were obtained. Lastly, curriculum mapping onto the national accreditation standards for Canadian physicians and the CAN-MED rules, an internationally recognized competency framework for medical practice, was done to ensure smooth and relevant integration.
We have developed 11 planetary health educational competencies distributed into 3 foundational domains. 1, advancing planetary health justice, including the competency of marginalized and at-risk populations. 2, managing and preventing health impacts, including food and water insecurity, air pollution and health, and mental health. And lastly, leading and collaborating on mitigation and adaptation, including ecological health promotion, disaster preparedness, and planetary healthcare. You can see the figure 2 of our poster for more details. Each competency is operationalized as a set of skills that future healthcare professionals can apply to their future practice. For example, in the changing infectious disease burdens competency, we will like students to be prepared to explain how climate change influences the spread of infectious disease threats through expanding the range of vectors of zoonotic illnesses.
In our work advocating for medical curriculum transformation to promote planetary health teaching, 2 significant barriers have been identified. First, the limited space for new curricular content, and second, the lack of faculty expertise to provide effective teaching. To address these barriers and enable prompt curricular change, we developed the ClimateWise Slides, which is an evidence-based tool that teaches our planetary health curriculum competencies and that can be seamlessly incorporated into existing didactic lectures. For example, for a lecture on asthma, the lecturer could go to the respirology section of ClimateWise, and you can see the little icon of the lungs on the poster, and find climate relevant information related to their topic of expertise, such as how wildfires increase emergency department visits and Ventolin prescribing. There's an example slide on our poster there. You will also see here that topics also include specialty-based topics like pediatrics, psychiatry, as well as public and global health topics like climate justice and environmental advocacy.
We are currently working with the Association of Faculties of Medicine in Canada to integrate the planetary health competencies into medical curricula across Canada. We believe that our competencies and the associated ClimateWise slides will prepare future physicians to identify and manage climate-related illnesses, to advocate for low-carbon and climate-resilient healthcare systems, and to collaborate on transdisciplinary initiatives to build healthy, thriving, and just environments for all.